Hello, hello, hello. What's up? All right, so I'm gonna wait 2 minutes and see if somebody shows up on the Instagram. So, hi, Benita. So today is the last day of the challenge, and hopefully you thought yesterday about your homework. Homework yesterday was to think about how foods may enhance how you feel and how they may take you down, like ruin your energy. And we were talking about caffeine yesterday. I'd say that gluten is a really good example for this, especially for me. Gluten, I got accidental exposure to gluten 2 weeks and some change ago, before the night before I was going to Houston to see my niece graduate. And I did not sleep all night. I tossed and turned, and I felt like the food that I ate was stuck in my esophagus. And I was at my aunt's house, so I didn't want to make too much noise. I finally remembered that I had gluten enzymes in my travel bag, and I also had some other digestive enzymes. So that helped. So the food, could get past the point where it was stuck, and I just kept drinking cold water or cool water. It wasn't real cold. But I really, really react very badly to gluten. So I've been recovering from that ever since then. And generally, I know from past experience that it takes me a couple of months to recover from gluten exposure. So I'm still treating myself for that. But today, so that's just an example, and you can think of examples for yourself. But I know for myself that my sleep is affected for months when I have a gluten exposure, so I don't get proper rest. And it's interesting because now they're finally showing in studies that for some people, gluten is so inflammatory that it can disrupt the sleep because it causes changes in the hormones that have to do with sleep and wakefulness. So that's just an example. But today we are going to talk about holistic approaches. We're talking about myasthenia gravis this week. And yesterday I talked about conventional therapies, and within conventional therapies, there are some therapies that are, thanks for your comment about the caffeine and your sleep. Yep, that's a good example. So some of the conventional therapies that we mentioned, like rest, exercise, physical therapy, are examples that kind of overlap in the holistic therapies arena. I go back to the functional medicine matrix. And if you're not on the Zoom right now, you can go to YouTube when we get done or whenever, and you can look at my orientation video. And I have examples on my orientation video of the functional medicine matrix. And I also have examples of a graphic that I formulated for my own practice that's based on the functional medicine matrix. But what's important to know is it's a different approach to treatment. So in this graphic, the mental, emotional, and spiritual health are at the center of the health, and control all the other aspects and biological systems. So the other biological systems that we take accounting for are assimilation, which is like digestion, absorption, all that GI tract stuff. And then structural integrity. Structural integrity is huge because you're talking about everything from cellular integrity to like muscles and bones, skin, all that is structural integrity. And then communication is chemicals moving around the body. Like we talked about the neuromuscular junction that's affected in myasthenia. But we have 600 hormones and neurotransmitters that constantly move around the body and give signals to the organs about how to react and what to do. We have transport systems, which includes the cardiovascular system, which moves the blood around. And then we have the lymphatic system that moves basically plasma fluids around the body. It's kind of like a parallel highway to the cardiovascular system. And it's super important when we think about autoimmune disease, because typically we see that lymphatic system is not working properly when people have autoimmune disease. It's kind of jammed up. And then we have biotransformation or elimination. And those systems are things like the liver and the kidney, the systems that help to carry the toxins outside of the body. And then we have the energy system, which we've been discussing parts of in this challenge, but I would say the most important aspect of that system are the mitochondria, which are inside of the cells, and also the chi or energetic system or energetic flow of energy through the body, as described by traditional Chinese medicine, but which is recognized in all types of energy medicine, Ayurveda, everything. Everybody recognizes that, and this system has been observed on electron microscope, and it's crystalline. It's made out of crystals, liquid crystals. So it's not something that traditional Chinese medicine, like, pulled out of thin air. It's actually been proven now that this system exists. And then defense and repair, when you think of the immune system, and in this case, the autoimmune issues that happen with myasthenia, inflammation, infection, and the microbiome. Microbiome are the microbes that exist in the digestive system, all over the skin, all over the body. They've seen microorganisms in the brain being transported by way of the vagus nerve from the digestive system up to the brain. So the microbiome includes the entire body. So what we do in functional medicine is we look at what issues are happening now in these different systems. And we also want to look at the mental, emotional, spiritual, because that is the crux of the whole, the subconscious, conscious crux of the whole body hinges on the mental, emotional, spiritual, which controls the health of the whole body. So, I've had patients with trauma asking me, well, other doctors are telling me it's in my head. This was when I was at the VA, and that would be kind of a negative thing that some of the doctors might say to the patient, or they may imply it by the way they were working up the patient. But the problem with that communication was that the veteran was not understanding that the mental, emotional, spiritual, and the doctor wasn't understanding it either. They were just trying to label the person with a diagnosis. But the mental, emotional, spiritual is controlling everything. So, a lot of people have things that have happened to them when they were between 3 and 7 years old that they have not processed, and that can contribute to autoimmune disease. Or maybe they have things in their adult life, like their marriages, their relationships that aren't going the way that they feel they should be going, or they are causing them to have negative emotions. That is contributing to autoimmunity. Those negative emotions kind of stoke the autoimmune reaction. So, we talked about the basics of the lifestyle factors that we're trying to modify, like sleep, exercise or movement, nutrition, and stress and relationships are thrown in there. So, the way we are going to approach someone that has myasthenia gravis is, the first thing is that we need to know the mental, emotional, spiritual. And a lot of times people don't want to go, oh, hey, Steve. A lot of times people don't want to go to have some kind of evaluation, either energetic or psychological, to kind of get a basis for the mental, emotional, spiritual. But it's very necessary. And when I work with people, I try to find something that's compatible with their belief system, something that'll work for them. And not everybody does well with talk therapy. So, there are a lot of different options. And then I would say the next system that we're going to focus on is going to be assimilation, because if you can't get the right nutrition to absorb into the system, the sickness is just going to linger and linger and linger. And 2/3 of our immune system is aligned or within the gastrointestinal system, which does the digestion absorption. So it's super important to have that humming, to have that working well. And we're finding now with the latest research that most people that have like neuromuscular, degenerative neurological diseases have had gastrointestinal issues for many, many years, and they have complicated gastrointestinal issues like SIBO, like small intestinal bacterial overgrowth. And it can take some months to get that rolling and to get things back to where they need to be. So I would say the other system that we're going to focus on probably really early is, I mentioned the energy system. That's super important. So along with the mental, emotional, spiritual, if the flow is not working in the body of the energy, person's not going to get well either. So, and sometimes when people have autoimmune disease, they have negative emotions that are kind of stuck in the body and not moving and not flowing. So those are things that we need to address. Biotransformation and elimination need to be addressed at the same time as assimilation, because in order to get toxins to move, we have to make sure that those systems are working. We have to make sure the lymphatics are working, which is part of the transport system, and the circulation. So you can see how everything is tied together and need to be coordinated in a way so that when the toxins start moving out of the system, that the channels are open for it to get out. So the liver is working well, the kidneys working well, and the lymphatics are working well. So that's a brief summary of what we're doing in our approach to autoimmune disease and our approach to myasthenia gravis. Like I mentioned yesterday, some of what we're teaching in physical therapy is energy conservation. And I have that video loading up on YouTube right now as we speak. So hopefully by later today, those videos will be loaded up. So, all right, any questions before we end today's session? These sessions are always just 15 minutes. And what I want everybody to think about for themselves tonight is, what is the best thing that you can do for yourself so that you can feel good? Is the best thing you can do for yourself like having a cup of green tea? Is it going to bed on time and getting up on time? Is it having a nourishing meal? Is it getting a massage? Those are examples that I would give for myself, but you can think of what examples are nourishing and nurturing for yourself. And the last thing I'll mention is that if you would like to have a free 10-minute phone consultation with me, please go to my website at treatyourself2health.com, treatyourself2health.com. Oh, I see Benita saying massage and a healthy meal. Yeah. So anybody looking for this type of help from the holistic perspective, functional medicine, integrative medicine, you can go to treatyourself2health.com, click on the top row of the contact page and sign up for the 10-minute free consultation. It's a phone consultation. When you click on it, it'll bring up a calendar and you can choose a time that's available that works for you. And I will call you when it's time for our meeting. And then also on that page, if you would like a more in-depth conversation by phone, you can, or, virtual by phone for a 30-minute visit to come up with a plan for your plan of treatment. You can, right next to the free 10-minute is a 30-minute, that's a paid 30-minute, and that's $147. And I would suggest before you do that, go and look at my orientation videos that are on YouTube. And what else? Oh, I have a membership now that's a very reasonable price. So a lot of times when people meet with me, they just join the monthly membership. And I'll tell you those benefits once we meet one-on-one, but it's a really good deal because you just pay a flat fee per month to get on with me for 3 times a month. And there are benefits of nutritional education, education about exercise, etc., that you get as a part of that. And if you're in a state that I'm licensed in, remote monitoring. So I can take a look at your weights, your blood pressures, your heart rate, etc. All right, so yay. Thank you, Miss Benita Dean. Thank you, thank you. Thank you all for joining today. Today's the final day. And like I said, I'm rolling the videos, the live videos onto YouTube. My YouTube channel is Treat Yourself to Health, or is Treat Yourself to Health. And the Instagram is Treat Yourself to Health. And Facebook is also Treat Yourself to Health. So you can go on there and find